Hi, my name is Nicola Lakeman, and today we're going to be doing emergency critical care. So we're going to be looking at triaging, primary and secondary surveys, clinical exams. Then we're going to move a little bit into the actual things that can go wrong. So seizuring, diabetic crisis, whelping, cesareans, pyos, and then we're going to be doing a little bit at the end on transfusion medicine. So that secondary survey is what we next need to go down. So the clinical exam, we would normally do all of this even before the vet is present, let's say. So we've scooped them up from outside, brought them through. Someone is taking a clinical history, what's usual thing, what's happened, when were meds last given, when were we last fed, all of those sort of stuff. One of the other nurses would be doing all of this. So TPR, temperature, pulse, respiration, it's not just the numbers. I think that's really, really important. Obviously, temperature is just temperature. But the pulse and the respiration is important just to go, oh, it was 40. I want to know, were they struggling to get those breaths in? How were they standing? What were the pulses like? What did they feel like? Were they bounding? Were they thin and Freddy? Did the pulses match the heart rate? All of those sort of things is what we really need to know. Blood pressure, obviously. Pain scoring. We use the Glasgow short form composite one for acute pain for cats and dogs, so we would pain score them. And we pain score them as soon as they come in, because we need to know what they were before we give them stuff, and we want to give them stuff as soon as we possibly can. So if you can get that pain score in really, really quickly, then that really does help. And obviously weigh the animal. If we can weigh these animals and get an accurate weight for them, by the time the vet comes in, they're normally shouting at you going, give it some whatever, and you're like, okay, I've already worked that out. I've already done this. And just find out all of that history can be really, really useful. So with respiration, I've put all of this in the notes. I think it's really important, again, I've already said it, we don't just know the number, we need to know the character of the breathing, because it can really indicate an awful lot of different things that are going on. So abdominal breathing, you've all seen it, the whole abdomen is moving. If you ever tried doing abdominal breathing yourself, it's actually really difficult. It really is. So, go home tonight and try and do this on the train tonight or something. Everyone will be laughing at you. But yeah, go for it. Asynchronous chest movements. So you can see them breathing in, but the chest is not moving at the same time. We do see this, we see it quite often in dogs that have been in dog fights and they've got a flailed chest, which is normally where the ribs are broken in a sort of almost a patch, and that bit's moving almost independently. Turned out elbows, again, that's going to be quite difficult depending on the breed that you're seeing. Because turned out elbows, if you're stood like this and you're trying to breathe, if that was a spaniel, you'd be a bit worried, wouldn't you? That's not normal. If that was a bulldog, you'd be like, yeah, that's quite normal. So again, that breed really does, you need to know those questions. But you will see, cats especially, they're sort of stood there just trying to get the air in. If you've ever done it yourself, go and do some exercise. So go run around the block at lunchtime, and then you're breathing heavily and try and breathe. If you put your arms in the air, you'll find it's actually easier to breathe, because you're sort of, I don't know if you're just opening up the airways or just removing some of the weight of your arm. I'm not too sure what it is. But if you put your arms in the air, you'll feel the difference. You really will do. So yeah, try it. Again, when they're breathing in and breathing out, is at the same time? Is it a couple of seconds to breathe in and a couple of seconds to breathe out, or is there quite a noticeably a different time issue there? We see a lot of cats with asthma. I don't know if you guys do. I'm going to say it tends to be more pedigree cats, more posh indoor cats. Maybe they're just more exposed to more environmental antigens and stuff. But again, you're going to get that prolonged expiratory with short inspiration. Crackles and fluid sounds. So again, all your brachycephalic breathes, you can almost say that's normal, but it's not right. And I think that's where we need to sort of get that across to clients. Yes, that's normal for a Frenchie to sound like that, but that's not right. That's not how a dog should sound. We see huge amounts of brachycephalics with aspiration pneumonias and all sorts of things going on. So make sure when you're listening or you're doing your respiration, stand back and watch the animal before you sort of touch it, poke it and all the rest, and see, you know, how it's breathing, get the respiratory rate, and then have a listen and count the respiratory rate, and make sure you're listening to all 4 sort of quadrants of the lungs, just so you can see or hear what's going on.